this is Dr. Kavita Sirohi. I am a pediatric dentist at the Little Dentist. So today I am going to discuss with you some oral hygiene tips for your little ones. So first of all, I will be discussing about the dental health of the newborn babies. So when we have a newborn baby in our house, we take care of everything, all the other things like the other overall hygiene and many other things about the kids. But when it comes to the oral health, most of us are unaware that it should be started with the gum pads itself. Even though the child doesn't have any teeth at that point of time, but yes my dear friends, we should start cleaning the gum pads with a clean wet cloth. Wrap it around your finger and just move your finger around the gum pads. This is very important because this is the first step which maintains the oral hygiene of the kids. Now, when to wean off the bottle feeding or the breastfeeding for the little one. So try to wean off the child with the breastfeeding or the bottle feeding habit not later than 1 year of age. So at the age of 1, please start and try to wean off the child with both the habits. Next is when to start with the brush. So where the first teeth of the child come, that is the right time when we should start with the brushing. First of all, in the initial time we can use a small finger brush which is easily available in the market. So that is also easier to use because we can wear it around our finger and it's very efficient in cleaning the little one's teeth. Later on, as with the age when the child is growing and also learns to spit, we can start with a regular brush with small bristles, small head, and also when the child will swallow the whole toothpaste and is not able to spit properly, at that time we can use a non-fluoride toothpaste for the child in a very small amount, maybe a smear layer or just a very small pea-size amount. As and when the child learns and develops proper spitting and is not ingesting the toothpaste, that is the time when we can switch over to a fluoridated toothpaste. It can be kids toothpaste also when the child is in a semi state, when he is sometimes he is a little bit swallowing the toothpaste. That is the time when he can use a kids toothpaste, and later on once he is fully efficient in spitting and rinsing, then we can switch over to a regular basic adult toothpaste. And yes, one important thing which we all skip, and that's a very small step, that is rinsing. Whenever the child is eating anything, not just candies, sweets, it's just the normal meals also, try to develop a habit of rinsing in the kids. It is very important because once we are eating anything, the food is definitely going to stick. So try to make a habit that the child has to rinse after every meal anything which he is eating. So these small steps are going to really help you with to avoid the big problems in the oral hygiene of the kids. Also, one important thing which I am missing is many parents, they are not aware when to visit the dentist, when should be the first dental visit of the child. So ideally we say when the first tooth of the child erupts in the oral cavity, that is the right time when we should see a pediatric dentist. Also, if we are not visiting at that time, then maybe by the first birthday of the child, we should try to visit a pediatric dentist, so that it's not necessary that there is some problem. Maybe they can guide you better with some tips or any measures which can be taken which can lead to the prevention of cavities in the kids. Thank you.